Keratopigmentation. In this video, the following subjects will be presented and discussed: goals, indications and patient selection, surgical techniques, pigments and properties, cases and results. Keratopigmentation is performed with different goals and indications such as following: pure therapeutic and functional, such as total or partial aniridia; cosmetic therapeutic, such as corneal leukoma; and pure cosmetic, for eye color change. Corneal tattooing has a long history, but modern keratopigmentation techniques have been introduced by Dr. Jorge Alio in the recent years. Two main surgical techniques may be employed. First is manual automated technique. In this method, a handheld, dye-injecting machine is used to introduce the pigment into the cornea. In the second technique, femtosecond laser is used to create pocket for dye injection. There are some other manual techniques that we no longer use and will not be discussed here.
Sequence of surgical steps are listed and shown here. Anesthesia, local or general, epithelial removal, determining and measuring the size of the cornea to be pigmented, based on the fellow eye. Marking and cantering new pupil according to the fellow eye. Determining and adjusting the color, based on the color of the fellow eye. Completing pigmentation, bandage contact lens insertion.
It is very important to follow and perform each step properly, to obtain optimal results. Manual automated keratopigmentation. This technique, itself can be performed by two main methods. Superficial painting technique is the original method that was developed by Dr. Alio. This is the most commonly used technique. After removing the epithelium, the superficial stromal layer is pigmented by painting and brushing, as shown in the video. When peripheral cornea is pigmented with desired color, the pupillary area is completed with black pigment. There is another method that was developed by the author and called deep puncturing technique. This technique is suitable for corneas that are edematous, thick or vascularized. Since the pigment penetration is deeper, it may be more durable. This technique should be used cautiously due to higher chance of corneal penetration. Different pigments and dyes have been used for keratopigmentation, such as organic fruit and plant colorants, India and Chinese inks. But we prefer and use micronized mineral pigments, because they are more biocompatible and durable. They come in different colors and give us the possibility to mix and customize desired hue. This is a case with sightless right eye due to chronic retinal detachment, hypotony and failed graft. As was mentioned earlier, it is important to measure the landmarks to match sizes of both eyes. It is evident that the corneal of affected eye is smaller than that of fellow eye. Automated manual keratopigmentation resulted in favorable outcome in this case. In femtosecond laser-assisted technique, a tunnel or partial pocket is created in the anterior corneal stroma with a depth of 220 to 250 microns, with sparing pupillary zone. For this purpose, intracorneal ring program of femto machine can be used. Toe radial incision are made for access into the tunnel. Then the tunnel is extended manually up to the periphery and dye is injected. The pupil can be done by automated manual technique or by femto, as in this case. If femto is planned, we should avoid interconnection of toe pockets. To avoid this complication, it is better to do periphery and pupil in two separate sessions and use different depths. This is a child with corneal opacity. Since the anterior third of the cornea was relatively clear on slit lamp examination, it was possible to use femtosecond laser technique. Although manual extension of the tunnel was a bit difficult, the ultimate result was very good. The pupil was done manually in this case. Here are pre- and post-op pictures of some other cases. This lady who had corneal graft, suffered from cosmetic problem due to annular peripheral corneal opacity. She was happy after superficial manual pigmentation. On the right you see two cases of corneal opacity and bullous keratopathy. Bullous epithelium was removed and deep puncturing pigmentation was performed for each patient. In follow-up of 12 months, the cosmetic results were good and no bullous was formed. Deep puncturing technique may prevent recurrence of the bullous keratopathy in such cases, due to scar formation. Functional visual problems such as disabling glare and dysphotopsia are other new indications of keratopigmentation. On the left and top middle, two cases from other colleagues with this problem are shown. On the lower middle and right, there are two cases of disabling glare and dysphotopsia, which were treated successfully by the author. Pure cosmetic keratopigmentation is another option for those who are seeking eye color change. For the time being, this application should be implemented cautiously and strict patient selection criteria should be observed. Despite high safety and effectiveness of keratopigmentation for therapeutic applications, it is not a perfect choice for pure cosmetic purpose such as eye color change. Although irreversibility and permanency of the procedure are not issues for therapeutic cases, they are the main drawbacks for pure cosmetic applications. Other concerns are possibility of color changing or fading in these cases. They may also have issue with undergoing MRI scanning. Meanwhile, the demand for cosmetic application is increasing, and we are approaching the time that this procedure may no longer be considered luxury and redundant. So, as caring surgeons, if we don't offer a safe and secure operation, the patients will go after disastrous ones, such as what happened with intraocular iris implants. Regarding these facts, the author proposes investigational efforts to develop intracorneal pigmented implants. They have to be ultra-thin, highly oxygen-permeable, biocompatible, durable, exchangeable and reversible without consequences. Thank you for your attention.